We are super excited to be talking about male hormones today and ways to manage a natural process called andropause. And we are a naturopathic clinic here in Port Townsend, Prosper Natural Health. I'm the clinical director, Dr. Molly Force, and I'm joined today with Dr. Mary. Mary, you want to give a hi? And then we also have Dr. Rosalie, who is just finishing up her last few days of maternity leave. So here at Prosper, we really love working with patients and getting to the root cause of what's going on with their health imbalances. And one of the cool things that I feel like we offer as a clinic is not just a holistic approach in regards to more of a Western medical view, but we also have not just the standard naturopathic view, but we also have these extra training components that Dr. Mary and Dr. Rosalie bring to the practice when we do team care. So Dr. Mary is trained in Chinese medicine, and that includes acupuncture as well as Chinese herbal medicine. And Dr. Rosalie is trained in Ayurvedic medicine. So it's been a really fun blend to get to offer more to our patients in regards to different strategies to helping them address their imbalances. So today, of course, we're talking about hormones, and we're talking about balance, and we're talking about what happens as we start to shift through andropause. And when we're having this discussion today, we're having this discussion really led with the idea that we're talking about people who have a testosterone dominance and have more androgens in their body. And we're going to talk about what that means. And generally, we're talking about people more who have penises and testes and prostates. And we make that differentiation because we have some patients who may be going through different hormone transition therapy. And so we want to be really inclusive, of course, in our conversation, but just make it clear that, of course, this is a discussion really for people who are on that more androgen, testosterone rich hormonal spectrum. So when we are looking at our bodies, they're going to be telling us a lot of different changes. Sometimes before we mentally know what's going on, we'll be getting these signs. And so as we're going through these slides today, we just want to welcome you guys to think about if any of these components are ringing true for you, that they might be signs that your body is trying to show that there's an imbalance. And of course, one of our big pieces today is we want you guys to walk away from this conversation with some good information and ways to actually address some of these imbalances. So we want to make this really worth your while. Please put any questions that you have in the chat as they come up. And that way at the end, we can make sure to get to those questions. We don't want anything slipping through the cracks. So when we're thinking about these hormones and ways to manage andropause, the first thing we need to understand is how to recognize some of these imbalances and some of those maybe even subtle signs that our body is giving us. And we also want to be thinking about why it's so important that we have that physiologic balance in check. So there really are truly some grave repercussions to having imbalanced hormonal sphere. So we want to make sure that we're not just saying, oh, this is, natural old age changes, things that happen as we age, but instead we want to say, what can we do preventatively to really make sure that we're walking forward with good quality of life. We also, of course, want to have tangible ways to look at, measure, and evaluate things like our hormone levels and the other influences, because today you're going to find out that it's not just about hormones. It's not just about testosterone level. It's more than that. And there are so many different pieces that can affect those balances. So we're going to be trying to go through that and really with the holistic viewpoint, say what other things may be influencing that balance for you. And then, of course, the reason why most of you are here is to really get some good tips and understanding of what you can actually do to help support that natural hormone balance. So the labeling of what we consider to be male menopause or andropause is kind of an interesting one. And even in the medical literature, there are different ways that we discuss it. And so I've actually had many patients say, well, male menopause, is that a thing? And I've had other people kind of joke and call it menopause. But the way predominantly that we discuss it as physicians is this term andropause. And what's nice about that is androgens, where we get that name from, andropause, from, or androgens are our hormones that are more along that testosterone type hormones. So we've got and we're going to go over them today. We've got our DHT, our testosterone, and our DHEA being our predominant androgen hormones in our body. So what happens around the age of 40 on average, we start to have these shifts where our androgen hormones start to decline. And particularly this is measured with testosterone in the medical literature. So the diagnosis clinically for us comes from a low testosterone level, typically measured in blood or salivary levels. And we're going to talk all about that and which ones we prefer and why here in a bit. But we just want you to understand what this is before we dive in. So as far as symptoms and changes that happen, any symptoms that are associated with lower androgens and lower testosterone deficiency are those symptoms and signs the body starts to send about the time where our testosterone is decreasing. So we see that oftentimes first in the sexual sphere, because we'll start to see men reporting lower libido or erectile dysfunction. Also, we start to see it in the somatic sphere, and what that means is in the physical body. So we see them reporting lower energy, weight gain. We're going to talk about that metabolic shift that happens, muscle loss, because we know specifically testosterone regulates our muscle mass. We often hear complaints about muscle and tendon pain increasing, bone loss, and we're going to talk about why that is. That actually is more estrogen caused, but we're going to talk about why there's a connection there. Worsening of autoimmune conditions, so maybe psoriasis or even other autoimmunity, whether it's rheumatoid arthritis or other GI or autoimmunities can get worse. And then we also start to see changes with our hair and potentially hair loss, more thinning. And then even with the skin, we see changes, maybe more dry skin, wrinkled skin, less beard growth. Beard growth is reported as well. There's also the mental emotional component. We talk about the mentation, so how we think, more brain fog, more risk of headaches, and then more mood changes, whether it's more irritability or feeling more prone to anxious reactions or even depression, and having less vitality and feeling like we have more like motivation to get our chores done or just even engaging in those things that we love to do. We also see this endurance decrease, and that's part of this behavioral change that we often hear reported and that we track with our patients too. So they might start talking about it with maybe they have a certain sports or maybe they like to ride their bike or something like that, and starting to notice that their endurance is shifting so that they're not engaging in those same athletic activities that they were before. So if any of those components harken true for you, put a little note here for yourself and be thinking about that, because that's going to be important as these hormonal pieces are addressed in your health. So I'm going to hand it over to Dr. Mary. We're going to go back and forth today and learn a lot.
All right. Thank you, Dr. Molly. Okay, so first let's talk through some causes of erectile dysfunction. This is one of the conditions that can arise during andropause. And, it's a very widespread condition and can be normal to some degree with aging. But there are some underlying causes that we really want to pay attention to. So normal erectile dysfunction will be decreased length of erection as you age, and some loss in libido, which is normal. For the most part, morning erections are normal and something you want to look for throughout your life. And the loss of morning erections is something that you want to pay attention to. So, and that can point to specific underlying causes that are kind of more physiologic in nature, such as cardiovascular or neurologic or endocrine causes. So, one of our first major causes is psychological. We really want to think about stressors within a relationship, and also in your life in general. So, you really need to be in a place where your autonomic nervous system can function properly. We have this concept of the parasympathetic versus sympathetic nervous system, and actually both of those pieces of the autonomic nervous system are involved in having an erection and ejaculation. But the erection piece is really the parasympathetic system that's at play, and that is generally considered to be our rest and digest piece of the autonomic nervous system. And that is a state that we want to be in when we're under a lot of stress, or kind of needing to be really focused on work or something that we need to attend to, that can be switches into the sympathetic nervous system, which can be and which can impair our ability to get an erection. The next piece is cardiovascular. So this is a huge cause of erectile dysfunction. And, if you have erectile dysfunction, it should signal you to at least go to your doctor and talk about potential cardiovascular causes. This is largely due to changes in your capillaries, which are the small vessels in your pelvic region. And this often arises from diabetes complications. So long-term untreated diabetes can cause changes to the microvasculature all over the body and can really affect the pelvic region. And there's another, we also want to look for, plaquing and atherosclerosis as a cause of that decreased blood flow as well. Neurological conditions are relatively uncommon, but something to investigate if you are having erectile dysfunction. And then endocrine conditions are relatively rare. So that's where we're seeing a decreased testosterone production, either from either starting in the pituitary, further up in the brain, or in the actual testes. And this is not going to be the focus of our doc talk, but that's another thing to consider on our underlying causes as well. As marijuana gets more and more common, it is another thing to think about. So we've seen with excessive marijuana use an increase in erectile dysfunction among heavy users. So it tends to be smoking or ingesting THC throughout the day or every day. And then we also have certain pharmaceuticals that can lead to erectile dysfunction, or can contribute to it. So these can be certain antidepressants, certain blood pressure medications, propranolol being one of them, and also prostate cancer medications, which actually are blocking testosterone as part of their therapeutic effect. So next we'll look at the regulation of testosterone secretion. So in people with testes, generally people who are male assigned at birth, we've got the secretion of GnRH from up in the brain, from the hypothalamus, which stimulates the secretion of luteinizing hormone and follicle stimulating hormone from the pituitary gland. This is going to communicate to the testes to secrete testosterone. And estradiol is also involved here in the production of testosterone. Interestingly, the majority of testosterone is converted from estradiol to testosterone. And it's important to note here that we do have these sort of stopgap mechanisms with most endocrine systems in our body. So if one's testosterone and or estradiol get to be too high, we will have inhibins that are feeding back to the areas in our brain that are causing the initial stimulation of testosterone secretion. So it kind of ends up being a closed feedback loop. So next, we're going to talk about what is happening with these male hormones, and actually with all of our sex steroid hormones during andropause. So first, let's look at testosterone. So testosterone itself is, one of our main male hormones, but is also present in females as well. And just to kind of set the stage for this, Dr. Molly had mentioned that we're talking about male hormones here as we typically discuss them. But when it comes to sex, we see hormones existing on a spectrum, and people who are male assigned at birth or female assigned at birth can all have varying levels of testosterone and estrogen and progesterone in them naturally. And so it's really about finding the balance that of those hormones that makes you feel the most whole and is most healthy for your body. So with testosterone, we see a diurnal rhythm. So that means that it changes throughout the day. And testosterone is actually secreted in higher amounts in the morning and decreases in the afternoon. And so for that reason, we always want to test our testosterone first thing in the morning, because it will be different if you test it in the afternoon. We also have a couple of different forms of testosterone. We have free testosterone and bound testosterone. So our free testosterone is a very small percentage of our total testosterone, and that's 1 to 4%. And that's kind of constantly shifting in and out of free and bound. And when it's bound, it is essentially attached to either albumin or sex hormone binding globulin. So interestingly, we have this natural decline with testosterone over time with aging, but the degree to which we have free testosterone available can really vary with lifestyle and dietary and other measures. And this is largely mediated via sex hormone binding globulin. So it's something that we really like to test, and I'll discuss that a bit more in our lab section later. But that when we talk about changing testosterone levels, in a functional sense, naturally with the use of herbs and diet and lifestyle, we're often really talking about changing that binding globulin versus testosterone itself. So again, it is normal to have a decline with age. So we actually see a 50% decline in bioavailable testosterone from age 50 to 84. So when we're talking about andropause and supporting you through andropause, we're really talking about how do we work within this kind of expectation that testosterone will decline and some of these changes will happen naturally. So let's see, we've got 95% of the production of testosterone coming from the testes, and then 5% from the adrenal glands via DHEA, which is another precursor hormone to testosterone. So we also want to consider our adrenal function when we're talking about testosterone release as well. So we can have changes in in DHEA production. So that's comes from the testes and from the adrenal glands, and that is also going to decline with age. And then we also will have changes with estrogen and progesterone, but it won't be quite as strong as our changes with testosterone. So one thing we will see with andropause is actually an increasing proportion of estrogen to testosterone over time. And sometimes that can be a good thing, and sometimes it's not what people are looking for. So it's an individual conversation always. So next we're going to talk through the hormone cascade. And here we've got testosterone can turn into a couple of different, it can turn into a couple of different hormones depending on which enzymes it's interacting with. So to the right, we have its conversion to estradiol through aromatase, and we'll talk about that conversion and how to affect that later on. And we also have a potential conversion to dihydrotestosterone, or DHT. So DHT is something that we absolutely need to get through puberty. So it's an essential hormone. But if it's too high later on in life, it can increase your risk for prostate cancer and also can cause male pattern hair loss. So that's one thing we really want to pay attention to and test for and make sure it's not too high, and that we're working with kind of modulating that 5-alpha reductase enzyme and preventing an overproduction of dihydrotestosterone.
So let's talk about how we can look at evaluating what's going on if you believe that you're starting to experience andropause or are in andropause. So one of the things that we like to do, of course, is talk to our patients. And that's one of the beauties of having a naturopathic clinical practice, is getting to be able to spend that extra time to ask people what's going on. And there are actual assessment questionnaires that are self-assessment questionnaires, which you could go online, and we put the little acronym of the one here. You could go online and download and do that questionnaire to see if you are matching up with your andropause symptoms of being likely testosterone deficient. But that being said, a lot of these things are things that we can understand just by talking to people, or just by you kind of paying attention to that list that we just went through. And if you're starting to experience those shifts, then we want to get that clinical evidence. So that's where we like to do some testing. We have 3 major ways of doing that. Our clinic is not usually using the urine testing because that can be so variable, but we like blood testing, and specifically with our hormones. For people who are undergoing menopause, we're often asking them to do salivary testing because many of the treatments end up using topical hormones. And for andropause, it's a little different because we have really good, accurate testosterone through the blood. So we can get both the free and the total versions in the blood form. And that's really critical because even if you have a high total testosterone, it doesn't mean that you have an adequate amount of that free, unbound hormone to do its job. So you might be having these declining symptoms of andropause and then get your test results back and say, oh, actually your total testosterone levels are normal, but that's not the whole picture. And so that's where doing this functional testing and looking at your free and total and your sex binding globulin is going to come in, and Dr. Mary is going to talk about that more in a second. But we like to differentiate the different type of testing for you guys, just so you understand that if you're somebody who might be considering TRT replacement, the testosterone replacement therapy, in the form of a topical, then a lot of times we will ask our patients to do the salivary testing, because looking at the before and after testing, it's really nice to be able to compare to the same reference ranges. They have different reference ranges. And also we know that Once we have hormones coming on through the skin, they're going to be available in different amounts via the saliva. We can get a more accurate record of how well those topical hormones are going. If you're somebody who's going to be doing something like injectable testosterone, then the serum or the blood work is wonderful and it's very adequate, or a finger prick even. So just different ways that we look at it. This is just a chart that shows from a study showing that depending on where we get the body fluid that's being tested, different steroid hormones like the topical, so our sex steroid hormones like testosterone, are not going to show up as accurate levels, for example, when we're doing our serum testing. So if you are doing testosterone cream as a replacement, we do ask our patients to get the salivary testing rather than the blood work done. So when we get that salivary testing, a lot of times we'll get reports where the lab will be charting people's levels, looking at the different age ranges here at the bottom and looking at where they fall within the reference ranges. So it's can be a really nice visual here, that this person has adequate testosterone. They're about 50 years old, 51 or 2, but that they have lower estrogens and on the lower end progesterone, and too low of DHEA, which remember is another androgenizing hormone that we want to have imbalanced. So we often will look at for cortisol levels at that point too, to look at what's going on with stressors. Sorry, there's very loud aircraft going over right now, so just wait for that to go by. So Dr. Mary is going to talk about cortisol and what that is and how we measure that, because that's going to play into symptoms of androgenesis.
Okay, it's passing. So what is cortisol? Cortisol is one of our main hormones that we consider a stress hormone. So it's the hormone that allows us to wake up and feel active and alive in the morning. And what we want is for it to be secreted in the morning and elevated in the morning relative to the rest of the day, so that we feel alive and awake and ready to start our day. And then we also want it to decline steadily throughout the day, to eventually let us sleep more easily in the evening. When we have that dysregulation, sometimes we'll have morning fatigue and insomnia in the evening. So as it relates to these sex steroid hormones, there's this phenomenon called the cortisol steal. So here you see that there's this hormone cascade, and starting with cholesterol, going to pregnenolone and 17-hydroxypregnenolone, we have the formation of all of our sex steroid hormones from that central point. And so one of the things that we want to look at is down here, coming from the 17-hydroxyprogesterone, we can either make cortisol, which is one of our stress hormones, or we can have this molecule shuttled into producing our sex steroid hormones, so testosterone, estriol, and estradiol, and various others that you see up there. So that's important because this is another piece of managing stress. We really want our resources to be going toward, or our biological processes to be functioning in a balanced way. And we want to produce adequate levels of testosterone over time, and not sending that all to cortisol production. So this is one thing to consider when we're going to discuss the stress management and how important that is later. Okay, so because of that, we'll often test adrenal function, and specifically we're testing cortisol production. And we will use this salivary test, which is the most accurate way of testing cortisol release throughout the day. And this is something that we'll ask you to take 4 different samples. So morning, and then 3 more throughout the day, to see if you're having that curve of cortisol rising and then decreasing later. We can also look at a couple of other measures, specifically the sodium to potassium ratio, because cortisol can affect our electrolyte balance as well. So here are some others we want to investigate when we're talking about andropause and specifically erectile dysfunction. So testosterone, again, we want to look at free and total testosterone. So that's going to kind of give us a sense of how much is active and available and how much is bound up in albumin and sex hormone binding globulin. We also want to look at LH and FSH. That's going to give us a sense of what is happening between our brain, our pituitary gland, and going down into our and how it's communicating with the testes. And then for sex hormone binding globulin, again, that's the thing that can bind up the testosterone and make it less active. So when that's really high, we have less available testosterone. So another really important thing to look at. And again, that's one of the ones that we can really work with and shift with dietary and herbal and lifestyle practices. We also want to look at the DHEA production from the adrenal glands, as that can turn into testosterone as well. And we want to look at DHT, again, largely because that can affect your risk for prostate cancer and early hair loss. And we also want to look at our thyroid labs. So the thyroid can play a major role in hormone production as well. Hypothyroidism or low thyroid hormones can actually increase sex hormone binding globulin and affect our availability of testosterone. So that's another thing to think about. And that comes with another host of symptoms that can be similar to andropause, like fatigue, like weight gain. We also want to look at our hemoglobin A1C and fasting glucose and insulin. Our blood sugar can play a big role in testosterone production as well. And so that's something we want to make sure is on board, and that we're, have a good, healthy blood sugar regulation. This can also really affect erectile dysfunction. So, as we were discussing before with long-term diabetes, that's you can have those microvascular changes in the pelvis, and that can really affect our ability to get an erection. So that's one thing we want to look at as an underlying cause of erectile dysfunction. Some of the last things here we want to look at is PSA. So that's our prostate specific antigen. Super important to look at in our male patients later in life, because we want to assess for your risk factors for prostate cancer. And then lastly, we in terms of other underlying causes of erectile dysfunction, in addition to that blood sugar regulation with the hemoglobin A1C, we also will want to look at a lipid panel and high sensitivity CRP. Those are both markers that will allow us to analyze your cardiovascular risk factors.
So our goals in working with folks are really to help find that balance, right? I keep saying that physiologic balance. So the reason, once again, to do this is to really make sure we're having preventative care in the most holistic way possible. So we want to be thinking about what protective benefits do we get from finding that balance. Probably the first and foremost for most of our male patients or androgen dominant patients is that cardiovascular protection. So we want to make sure we are not putting them at higher risk of cardiovascular incidents by having dysregulated hormones. We also see risk of having neurologic changes and central nervous system brain changes. So we want to make sure we're supporting that by having those hormones balanced. Bone support, so the osteoporotic sort of piece, we know once again, estrogen is actually our dominant hormone that helps with that. And we have that, you guys saw that hormone cascade, testosterone is going to help build that estrogen. But once again, we want that in balance. We don't want a dominance of estrogen for most people there, but we want enough so that those bones are protected. And then our immune system is also affected by our androgen hormones and our testosterone. We also, of course, want to be thinking about quality of life, the ability to do the sports and the things that you love and to get the activities done throughout the day that you want to get done, and then having adequate libido and not feeling like you're really suffering from ED. So these are all really important pieces that we always like to be thinking about for patients, once again from that preventative aspect, but then also just making sure that they're getting that quality of life that they are looking for. So we want to talk to you guys about ways that we can actually help rebalance the system. So some of the main ones here that we're going to be talking about are helping maintain healthy body weight. And the reason that that is because, like you saw Dr. Mary explain, testosterone can be converted into estrogen, and it really likes that aromatase pathway a lot of times. And there seems to be this kind of chicken and egg cycle that happens with the more body fat and lipids that are put on a person, and the more they're metabolically imbalanced to have excess weight and obesity, the more estrogens are created. So remember, those fats themselves are going to help increase that aromatase and increase that conversion testosterone away from the higher levels of testosterone and more estrogens being built, manufactured. And then we have more promotion of the body fat because of that. So it really does become this challenging cycle to stop. So that's one of our big pieces we're often working with patients on, is rebalancing their metabolic system, which is why we get so worked up whenever there's imbalances with things like insulin and pre-diabetes or diabetes going on. We also know that stress reduction is massively important here. And we've talked about why cortisol affects it with the cortisol steal. So you can kind of understand physiologically why we make such a big deal of that as physicians. We know that we can have more testosterone naturally produced by incorporating things like exercise. We're going to talk about that in detail. And then we also know that if we minimize excess exogenous chemicals coming in, then we have less impact on our liver. We're going to talk about how the liver is going to be a really important piece here for conjugating and production of our hormones. And we know that alcohol consumption, and we're going to unfortunately pinpoint beer here, and I'll talk about why that is too, we'll find is also another big one for staying balanced. So when we're going through these tips today, we've kind of put them into different categories. So we've got our diet and our metabolic balance piece, we've got our exercise piece, we've got our liver support piece, we have herbs and different supplements that are going to be supportive. We have testosterone replacement therapy, hormone replacement therapy, we're going to talk about as well, and then sleep and stress management. So if you've kind of been categorizing some of your own symptoms and signs for yourself, as we've been talking about, or for the loved one that you're watching this talk for, we want to, take a minute and think about which of these different categories might make the biggest impact for you. So think about that whenever you're deciding to make some of these changes. So the first one we want to talk about is diet. You'll find that, especially with naturopaths and naturopathic physicians, we love talking about diet and nutrition. It is very central to us, the old adage, you are what you eat. So when we're talking about ways to reduce andropause and reduce testosterone being too low, we're wanting to make sure we get in adequate proteins. So a lot of times for our patients, this is coming in the form of meat, shellfish and fish, nuts and legumes and eggs. So we also want to be thinking about adequate fats, and I'm going to go into that in detail here in a minute too. But that, of course, includes things like our nuts and our seeds and our avocado and our good healthy oils, and we're going to talk about those. We also need to be thinking about carbohydrates. Once again, in balance. We want to limit excess carbohydrates. Now, think about what we've talked about so far with the physiology of how this works with that aromatase converting our testosterone into our androgens. We know that excess carbohydrates are going to increase our adipose tissues, our fat tissues, and that's going to increase our estrogens. So we want to stay away from that pathway. So we want to make sure that we're not getting an excessive amount of carbohydrates that many of us have in our standard American diet. So really focusing on things like whole grains rather than the refined carbohydrates, obviously paring out any of our excess sugars whenever possible, and really choosing those protein and fat-rich foods to keep your blood sugar stabilized. Generally, we want to choose fresh fruit rather than dried fruit or fruit juices because they're going to be so high in sugars and they're going to spike our glycemic reactions and cause a flood of insulin, which increases our risk for more of those fat cells to be laid down and more of that estrogenizing pathway to continue. We, of course, want to avoid a lot of our artificial sweeteners. Now, we know that those imbalance our microbiome, which can't get through a talk without mentioning the microbiome, but we know that that imbalances those, but they also do more. They can be very problematic as far as our liver and how our liver can become busy and not able to deal with our hormonal conjugation appropriately because of that. Now, I'm pinpointing beer here when we're talking about alcohol consumption and keeping that really low for folks who are dealing with andropause shifts. And the reason for that is we know that beer is a phytoestrogen. So it's really wonderful and enjoyable, but because it's a phytoestrogen and because it's typically higher in carbohydrates, it's going to be pushing more of that aromatase pathway, which we really want to back away from because we know that that can be really problematic for our overall hormone balance. We also know that fiber is going to be really a helpful thing for us for many reasons, colon, prostate, and beyond. But we know that that's going to also help with our blood sugar stability. So thinking about having our metabolic piece really dialed in. So that should be a discussion with your healthcare practitioner. And a lot of patients don't even know that they're pretty far down the path to being either pre-diabetic or diabetic. And a lot of times it might show up with a little extra girth around the abdominal, the midsection. But remember, that is going to perpetuate our low testosterone and elevated estrogens, and it's going to make that cycle continue. So a big question that we get from a lot of patients is intermittent fasting right for me? We know that it really does help decrease insulin levels, and that's going to affect our risk of becoming pre-diabetic and diabetic. It's going to help those insulin receptors become more sensitive, work more effectively. So that's going to help us with our weight management and ultimately our hormonal goals when we're dealing with andropause. Now, there are different strategies here, and we've kind of laid them out for you guys to look through. There's more intensive intermittent fasting where you're fasting for longer periods of time throughout the day, the 16 hours and then 8 hours of food intake, or there's shorter where you're doing 5 hours on, 5 hours no food, 2 hours with food. And then there's also people who will do alternate day fasting. Now, there's research about all of these different types, and we recommend that you talk to your healthcare practitioner about what's going to work. But I will say, with most of my patients who are dealing with metabolic imbalance or dealing with issues of having excess aromatization towards those androgens and having more, especially abdominal obesity, one of the first things we start is no more snacking after dinner, moving that dinner time up and making sure that they're going a longer period of time before their breakfast happens in the morning. So we usually cut out that evening snacking before we push back their breakfast time, if that makes sense. So as far as omegas and as far as healthy fats, these are going to be absolutely critical. Now, we talked about testosterone starting out in that steroid pathway as cholesterol. So we do want healthy cholesterol levels. We don't want too high, but we don't want to suppress it too much with our things like our statins. So having our healthy cholesterol is going to be a building block ultimately for our testosterone. So we want to make sure we're really choosing cholesterol-rich foods that are going to give us the biggest bang for our buck. And that's ultimately those that have the omega-3s in them, like the marine, the fish oils, the marine lipids, we call them. So the fish and the seafood are going to be giving us the majority of that. We also can get those things from flax and chia as well. Um, Also remembering to include a variety of different seeds and nuts, especially in the whole raw form in our diet, can be really helpful as well. They're not going to have as many of those omega-3s, but they'll have some of the other important omegas for us as well. So in general, we're recommending our patients step away from the omegas that are going to be higher in like omega-6 and 9, these oils, because they're considered to be more inflammatory. So if you have a choice for cooking oil, we usually want to think about the fruit oils. That's like your avocado oil, your coconut oil, and your good old olive oil for cooking. So the really refined oils in the seed department, like our soy and corn and canola, peanut, sunflower, safflower that we see in a lot of our chips and crackers and refined foods, processed foods, those are much more inflammatory. We want to take a step away from that, and that helps us out metabolically as well and gives a little break for our liver. I also wanted to make sure that we talked about today selenium, because when we're talking about male predominant hormones, we are thinking about ultimately protecting your prostates. So remember, selenium is one of our most protective nutrients, minerals against prostate cancer and prostate problems. So generally, we're recommending people to include selenium in their diet. And you can get that from Brazil nuts. And also you could be supplementing with selenium if you'd like as well. So just 2 of those nuts a day will fulfill that daily need. Also wanted to just make a quick mention of zinc, because zinc is going to be really important in spermatogenesis. So that means in the production of your sperm. So there are very rich foods in zinc in regarding our shellfish, our oysters are some of the top. We also see it in many of our meats, especially and organ meats like grass-fed beef liver, for example, is very high in zinc. We also can find it in mushrooms, certain whole grains. Pumpkin seeds is another really good one that's not on that list. And we do have some in kale and peas. So zinc helps not only with managing our immune system, but it helps in that production from the testes of the sperm. So really an important one to make sure is in your daily diet routine in some form. Phytoestrogens, we also wanted to mention, because if we're having excessive amounts of estrogen, we're having a problem where we're no longer in our androgen dominance, which is generally what we're wanting for most folks going through andropause. We're really wanting to push that testosterone level up. Now, what's kind of interesting about phytoestrogens is these are plant-based chemicals that mimic estrogens, and they fit like a key into the receptor sites, into these estrogen receptor sites. And they can be really helpful to some degree because they actually can reduce things like DHT. Remember how we talked about testosterone converting into that, and long term that can be problematic for things like our prostate cancer risk and hair loss risk. So these actually can be really helpful because they mimic estrogens and fill up the place that normally our estrogens would be filling up. So consuming a balanced amount of phytoestrogens can be really helpful, but excessive amounts, like if we're drinking beer every day, for example, that's not what we want to do. So including some, but not a ton is kind of the name of the game there. And now we're going to talk about the physiology of exercise and movement.
All right. So exercise is important for so many things. Kind of, it's always one of our health hacks in every DocTalk. And specifically for andropause, there's some key pieces to think about. So research has shown that exercise first thing in the morning can increase growth hormone, and growth hormone is another hormone in our body that will directly stimulate the release of testosterone. So that's another reason in your list of reasons to start your day off with some moderate to high intensity exercise. So the goal is going to be an hour, 5 to 6 times per week of moderate to high intensity exercise. And we also want to be sure to incorporate weightlifting and running. So this kind of anaerobic activity to increase growth hormone as well, which again will directly stimulate the secretion of testosterone. So again, it's going to help with metabolism, which is going to help with those blood sugar pieces that we were discussing before, in addition to directly impacting our hormone release. So another thing we want to think about when it comes to exercise and lifestyle is therapeutic sweating. So this can be through, bundling up and exercising outside. It can be using a sauna or a hot tub. But with any of these, our sweating is going to engage the body's ability to naturally eliminate our toxins through our skin. It will also increase our metabolism and help break down fat tissue, helping us release those fat soluble toxins. So first of all, breaking down fat tissue is helpful to reduce that estrogen, the conversion of testosterone to estrogen peripherally, in our bodies. Second of all, we want to release those fat soluble toxins, which include what we call xenoestrogens. So xenoestrogens are found in plastics and other synthetic materials, and they bind to estrogen receptors as well. They're ubiquitous in the environment. Most of us have it stored in our fat to some extent, and exercise and sweating are going to help release some of those.
So since we're talking about sweating, which is considered a secondary emunctory or exit route for the body, let's take a second and just talk about some of the primary ones. So the reason we talk about this is because, once again, with hormone balance, we want to make sure that the correct hormones are conjugated, which means converted, and then exiting when they're in high levels, right? So we want to keep them really nicely balanced. So you guys know that we have our lungs, which are doing the majority of our respiration in regards to exchange of gases. We've got our kidneys, which are dealing mainly with our water and fluid systems. We've got our colon, which is going to get rid of the bulk of the mass of the food that we're eating, but also is a major exit route for the majority of our hormones, our sex hormones. And we've got our liver, which is kind of like the oil filter sort of the body. So it's going to be doing a huge amount of job with the conversions of these hormones, as well as production of our protein and the managing of our metabolic system in regards to our glucose levels. We also have our skin, which is another primary emunctory where we're sweating through, that Dr. Mary just talked about, and our lymphatic system, which circulates our immune cells and helps us with our inflammatory reactivity and our immune response in general. So when we're talking about the liver, because that's going to be our big workhorse when we're thinking about these steroid pathways, we know that maintaining a healthy body weight and exercising regularly is critical. We know that reducing excessive chemicals, which are going to be damaging, and putting more work on it is the next big critical piece here. So that means watching out. Too much alcohol, of course, is going to be liver toxic, and things like cigarettes or even chemicals that we're exposed to on a day-to-day basis, maybe at work or even at play. And then thinking about having a really clean diet. So we say a whole foods diet, which means not having a lot of preservative rich and processed foods. Staying hydrated, of course, is a very important piece for our liver to be functioning properly. And then making sure that when we're choosing medications and supplements, that we're doing it really wisely. And the reason we say this is even sometimes when we have the intention of taking healthy supplements for ourselves, sometimes they can either be not what they say they are and more of a dangerous thing if they're not like a physician grade supplement, or sometimes we can just physically take too much for our liver to be processing. Same thing with our pharmaceuticals, like daily use of, a Tylenol or even an Advil, ibuprofen sort of scenario could end up being hard on our liver as far as conjugating those kind of things out. So we talked about watching out for alcohol. Sometimes that's easier said than done, but remembering especially to watch out for excess beer intake if we're focusing on the andropause piece. And then, of course, making sure that we are watching out for these estrogens that Dr. Mary was talking about. So those are those external chemical estrogens that are not made inside of us, but are coming from things like plastics and from chemicals in our environment. And things like fiber in our diet, like those legumes, can help with binding those and exiting them out through the colon. Brassicas are the other big workhorse here. Now, brassicas, if you know what that means, gold star, it is the broccoli family or cabbage family of plants. Now, they help specifically with breaking down excess estrogen. So, this is a big deal for our patients with excess aromatization and who are dealing with testosterone deficiency because their testosterone is going down that pathway. So we've got these wonderful family of cruciferous or brassica family plants, and we know that they're full of not only fiber, but these specific antioxidants that help biotransform these toxic forms of hormones, specifically our estrogens and our estriones get pulled out with those. Now, SGS is the shorthand for a sulforaphane byproduct, which is in these type of plants. So that's like our kale and our bok choy and our broccoli and our cauliflower and our cabbage. Okay, so that's kind of what we're thinking about. We can take supplements of this because it can be so very helpful for people who are dealing with high cancer risk, prostate cancer, colon cancer, those kind of things. We're thinking about actually supplementing with this, but generally, we're also recommending including these types of foods in our diet to support that liver function and removal of these excess toxic hormones.
All right. So next we're going to get into the herbal medicine that we can use to support you through andropause and also with erectile dysfunction. So here we've got a couple of different herbal categories and actions. The first being the adaptogens. We'll also talk through aphrodisiacs and circulatory stimulants and herbs that affect our hormone balance in different ways. So adaptogens is a category of herbs that is used to describe herbs that are affecting our adrenal output and traditionally are known as tonic herbs in Western Chinese medicine and Ayurvedic or ancient Indian medicine. So we've got a couple of big ones here that are often used for males as they age, in addition to people of both genders, but they're specifically kind of traditionally used for stamina and for libido as with aging. So we've got ashwagandha, also known as Withania somnifera. Its name in Sanskrit, I believe, is translates to sweat of a horse. And it's a really great one for folks who are really wired and tired. So, not sleeping well, having really low energy throughout the day, and undergoing a lot of stress and too much kind of mental activity, impacting your ability to really get into the central aspects of life. Um, we also have red ginseng. This is one of our major tonic herbs used in traditional Chinese medicine. And it's also used as specifically a male tonic. And in the case of if someone has combination of fatigue and erectile dysfunction. And then we also have gokshura, or Tribulus terrestris. This is an adaptogen with an affinity for the bladder and genitourinary system. Again, enhances stamina and energy. And with all of these, there's a common mechanism that we see, that cortisol release is modulated or kind of suppressed in higher amounts, so that you have a more even release of cortisol throughout the day. So that's kind of how they help us maintain an energy balance. So we have this one formula that we often use with our male patients that you can check out, that has a number of these herbs that we'll be discussing here, called IU test. Interesting one to look at. So next is our aphrodisiac or section, and these are ones that specifically if libido is an issue. So if there's kind of a psychological impact and libido is declining, Damiana is a really great one. It is a kind of one of our stronger herbal aphrodisiacs. It helps relax smooth muscle, and it's really great to take prior to a date or a sexual activity, and it can help you kind of get into a more relaxed mindset to engage in sensual activity. And then we also have yohimbe, which is more, it's also a nervine, but also it's very stimulating and more physiologic in its action, or kind of stronger in its action, I suppose. So it's a low dose herb, and we want to use in caution with people with cardiovascular disease and high blood pressure. It can act as an alpha adrenergic blocker, so that's helpful with erectile dysfunction, and it can increase libido in both males and females by increasing circulation in the pelvic region. All right, next we have more circulatory stimulants. So we've got ginger, things like ginger, ginkgo, and nutmeg. These are often used in tea form or tincture form. And by supporting that vascular microcirculation all over the body, and specifically in the pelvic region, it can help support an erection and maintaining an erection. We also have nutmeg is specifically helpful in the case of premature ejaculation. All right, so here is one that we use very often in the case of elevated sex hormone binding globulin that's binding up too much of our free testosterone and lowering bioavailable testosterone levels. So nettle root, nettles are ubiquitous around the country, and particularly in the Pacific Northwest, are the ones that sting you. And we use the leaves for other reasons, but the root itself is something that can be used in a tea or tincture form to reduce sex hormone binding globulin and thereby increase testosterone. And then it also has been shown to decrease DHT, or dihydrotestosterone. So here's a number of things we can do to lower DHT. So again, we were talking about DHT as increasing our risk factors for prostate cancer and male patterned hair loss. And we have one supplement that I like to use a lot for prostate support, that contains genistein, which is an extract from green tea. Genistein is a type of phytoestrogen in soy. And then we also have a green tea extract, pumpkin seeds, saw palmetto, which is one of our main herbs for preventing the conversion of testosterone to DHT. And we also have the stinging nettle root to decrease sex hormone binding globulin. So it's an all-around good, it's a well-rounded formula for testosterone support.
So let's talk a little bit about TRT, or testosterone replacement therapy. So many of you may have already experienced this. It is kind of the next step up for us after we have done some of the more holistic approaches. We want to, of course, not neglect things like our diet and our lifestyle. But if we've been utilizing some of our herbal strategies and really engaged in the diet and lifestyle stuff and still not seeing the results we want, TRT is something that we do manage at our clinic here. Our goal, of course, is always to find that sweet spot, that physiologic, stable balance. And what we want to do generally when we're thinking about lab work is get our free testosterone, remember that unbound testosterone, up into the upper quintile or portion of its range. So we want to make sure it's on the higher end of our normal area. Now, we also want to make sure that we're not having too much convert over into estrogen, because sometimes if we just give testosterone and we haven't addressed this aromatase issue or excess DHT issue, we're going to have a problem. We're going to be feeding into more problems. And our ultimate goal is to be thinking preventatively, how can we help with better quality of life long term for folks. So we want to keep that estrogen to that testosterone to estrogen ratio really balanced, and it's something we want to track. So with our TRT patients, we're really asking them to do follow-up blood work and or salivary hormone work to really keep track of how things are going. Now, we have some patients where it's not appropriate to do TRT. And so it's something that we talk about them with different risk factors. A big concern for a lot of people is prostate health. And we know from the literature that testosterone doesn't cause prostate cancer, but its derivative factors can increase our risk. So if we're having too much conversion, for example, over to DHT, we have problems. Additionally, we know that if you already have prostate cancer and you start on testosterone, your PSA will typically start to escalate very quickly. So we want to really keep an eye on those levels as we have people on testosterone replacement to make sure it can be a way that we might even find an earlier case of prostate cancer than we thought if all of a sudden those levels start to increase rapidly. So the other piece here is there are different forms that we'll use. Some people do really well on the injectable form. There's some major advantages of it. Typically, one of the biggest is that you're not passing it to partner. You're not, putting on something on topically that could be then rubbed onto a partner, animal, that kind of thing. The other piece has to do with a lot of times people will feel like they can really keep their levels very well balanced with the injectables. Now, the topical is also a great option for some patients. And so it's also, something that we will prescribe if needed. And we also do at our clinic use compounded versions of testosterone too. So we have the availability to have very, very small dosing of TRT if needed and if appropriate. So it's always something that we're looking at our patients' individual labs, talking about their goals with them, talking about potential side effects with them, if it's worth increasing because of we're thinking about that entire hormonal cascade. And then we're designing an appropriate TRT strategy for them. It is a controlled substance because it is something that can be very easily overused, and people have used it, especially in the athletic world, to really get excess muscles and perform athletically with. So it is something that, the DEA watches carefully, those prescriptions, and we do have to make sure our patients are coming in twice a year to discuss those prescriptions. But they can be life changing if it's needed. It is a very important strategy for our clinic. Now, as far as other strategies here, we also, of course, cannot neglect sleep, and we cannot neglect the stress component. We talked about the cortisol piece. So if you do not have your sleep dialed in and your stress dialed in, even if you start on something like TRT, you might not still feel that great. So we've got lots of different strategies that can help support things like sleep, and that ultimately will affect our cortisol, and that will help reduce that cortisol, steal away from that testosterone. And remember when we went through that hormone cascade. So some of the things that we see that can be really helpful with that are, of course, things like melatonin, although it's not appropriate for all patients. There are certain herbs that we use, making sure our sleep hygiene practices are really good, quiet, dark spaces, not having a partner sleeping next to us that might be snoring, making sure we're evaluated for sleep apnea if our own apneic issues are getting in the way of good sleep. We really want to make sure we're curbing any stimulants and watching out for the excess depressants like that alcohol in the evening that could be affecting our sleep patterns. We use different herbs sometimes and different nutraceuticals sometimes for our patients with acute issues with sleep management and stress issues. For more chronic issues, we'll be using adaptogens and adrenal supportive herbs quite a bit. We often will want to talk to our patients about different breathing strategies and mindfulness meditation, things that can help stimulate our vagus nerve, which we'll talk about in just a second. And then, of course, there's also certain counseling and biofeedback that can be incredibly helpful whenever we're dealing with stressful issues. So stimulating the vagus nerve, because remember, that's going to help that parasympathetic nervous system, that rest and digest system that's so important, especially when we're dealing with imbalances in libido and things like that. So making sure that we're engaging in certain things to support our vagus nerve, which is this very important cranial nerve 10, and it goes throughout your body and innervates different major organs in the body. Now, one of the simple ways to do this is to hum or to sing. So it's a great thing to do when you're driving along in your car. Turn on the radio and hum or sing. Gargling, we know, can help stimulate that. Also, just immersing your face in cold water, so a little cold spray in the shower or when you're washing your face in the morning or evening. And then practicing that deep breathing, getting in some of that meditation time, breathing specifically through your nose, nice slow breaths in and out can help with that vagal response. Now, adaptogenic herbs we just touched on briefly, but those are things like our ginsengs, Asian and Siberian, our ashwagandha, remember that withania again, rhodiola, our holy basil, also known as tulsi, things like our licorice as well. And it can also be very helpful for that healthy adrenal feedback loop, reducing that excess cortisol that can really be, once again, stealing away from our healthy testosterone production. I'm going to hand it over to Dr. Mary now, our expert in Chinese medicine.
All right. Thank you, Dr. Molly. So, in addition to practicing naturopathic medicine, I'm also an acupuncturist and practice acupuncture and traditional Chinese herbal medicine at Prosper. And I really love this approach because it allows me to kind of see each patient through a different lens that can kind of coexist alongside my Western biomedical understanding of physiology. And so it's a really great tool that I love bringing in with patients alongside the naturopathic care. So when it comes to andropause, from a traditional Chinese medicine perspective, there is again recognized as a natural phenomenon, and in the traditional Chinese medicine kind of philosophy, we consider it a declining kidney essence. So the kidneys are so in the Chinese medical system, each of the organs are related to physiological function. There's 5 major organs, and they're each kind of interact with each other in complex ways, but our goal is to balance all of the organs. And the kidneys specifically are like the Western understanding of kidneys in that they are involved in urination and they're largely, and that is recognized in the Chinese medical system, but also in the Chinese medical system, they are dominate growth and reproduction and aging. So we have this concept of the gene that we're born with, and you have kind of a set amount throughout life. And in males, you actually they say that you deplete your jing through ejaculation. So that's something that is, a connection where like too much sex can actually deplete your kidney essence. But specifically here, when we're using Chinese herbal medicine and acupuncture, we want to address the kidney system through herbs and through our meridian system. And we'll discuss more on that in the next slide. So some of the major herbs that we use within the Chinese medical system are going to be yin yang huo, appropriately termed horny goat weed. So this is one that is often used alongside other formulas that are used to tonify the kidneys, and it's used specifically for erectile dysfunction. And in the traditional Chinese medicine sense, it's tonifying kidney yang. So yang is that heating, activating part of between the yin and yang system. We also have an herb called he shou wu. This is known as a Jing tonic, and this one can really be used long term for male hair loss, and also it's really more for fatigue and hair loss. And it can be used to enhance libido. And this one translates to Mr. He has black hair. So another, reducing aging and kind of supporting the kidneys that way. Lastly, we've got acupuncture. And, I use acupuncture in many different ways. And this is a really great way to help with stress reduction, body pain, and it is something that can be used for erectile dysfunction as well. So, it's a great hands-on therapy that I really like to use to address many different complaints. So often a combination of fatigue and body pain.
Thanks, Dr. Mary. So we want to just invite you guys, we're kind of coming to the end here. We want to answer the questions that are in the chat, but we want to also just make sure we take a moment and invite you guys to our talk that's going to be next month about holistic cancer care and prevention. So we will be talking about prostate specific components there, as well as colon cancer as well. So if you guys are feeling like you have any components that we talked about here that need more discussion, please reach out to us. We're here. This is what we love to do. We love helping folks get these balances corrected. So we welcome you to do that. Just give us a call or jump on our website and make an appointment. As far